Chapter 34, Therapeutic Groups. So a group is an interconnected and interdependent set of individuals who come together for a shared purpose. A therapeutic group refers to a group of people who meet together for personal development and psychotherapeutic growth. Now there's advantages. These include the ability to treat multiple patients simultaneously, having members benefit from another person's point of view, and it provides a safe place to practice new skills. However, there are disadvantages because there are privacy concerns. There can be disruption. Group norms may hinder personal expression, and you can see this in box 34.1, the advantages and disadvantages on page 608. Now, therapeutic factors were created by Irving Yalom, which identified core principles of a group that make it therapeutic, causing healing and creating change. And you can see this also in table 34.1 on page 608. Now, group content. These are the topics covered in the group. Everything that is stated in the session is considered group content. Group process is the group's dynamics or how the members interact with one another. The group process must be managed and supported in order for the group to be effective. And then group norms. These are acceptable behaviors and expectations that are within the group. So phases of group development. A group goes through distinct phases during development, and in each phase, the leader has roles and challenges to support the growth and change of all group members. In the planning phase, this includes specific characteristics for the group, such as name, objectives, types of individuals, schedule, setting, seating layout, leader and member responsibility, and the method to evaluate outcomes. You can see box 34.3 on page 609 for terms describing membership, such as your heterogeneous groups, your homogeneous group, closed group, open group, and your subgroups. Now, during the orientation phase, this is forming the group with the leader establishing the purpose and promoting respectful, meaningful interaction between the members. The working phase, this is where the leader facilitates communication and conduct among members while resolving conflicts that may arise. You can have storming, norming, and performing, as you see here on page 610. Now, storming refers to the disagreements, attempts at dominance, and personality clashes that are addressed in order for the work of the group to be done. Norming occurs when personality clashes and disagreements are resolved and a spirit of cooperation emerges. And performing groups have established norms and roles, and these group members are focused on achieving their goals. Now, during the termination phase, members express feelings about group experience. They provide positive but also negative feedback during this stage. So there are roles in groups. Task roles keep the group focused on the main purpose. The maintenance roles keep the group together and help others feel included. And then you have individual roles. This relates to specific personalities, personal agendas, and having personal needs met. Table 34.3 on page 611 digs deeper into this. So psychiatric nurses Ben and Andrea want to start a support group for teenagers with HIV. Their goal is not only to offer health education, but to provide a safe place for teens to share their fears, concerns, hopes, and encouragement. They have determined that there is sufficient interest based on feedback from the city's healthcare centers. They will most likely choose to meet in one of the area mental health clinics or church meeting rooms. Andrea says she's concerned about whether a co-ed HIV support group will share as freely as one that's all female or all male. Ben feels it could work because he suspects very few conversations will be about sexuality. He feels the group will be far more focused on living with and managing HIV itself. After some discussion and polling, however, they decide they have enough interest to conduct two different groups. Ben will work with males and Andrea will work with females. Ben and Andrea decide to create two completely independent and separate support groups. This means that Andrea's group, consisting of adolescent girls with HIV, is a what? They are C, a homogeneous group because all members share central traits. Ben's group is very involved with lively discussions. Which of the following comments made by members of a group best demonstrate a task role? D. We started out talking about guilt, but we have strayed from that subject. This is keeping the group focused on the main purpose. Theoretical framework. A theoretical framework is necessary for analyzing the group dynamics and progress. And there's some terms here. You have humanism. This is self-actualization, and it's a subjective experience. Cognitive behavioral, the focus is on maladaptive behaviors. Psychodynamic, resolving intrapsychic conflict. Educational, this is practical support. And systems, this is a social interaction. And you can find more here in table 34.4 on page 611. Now, nurses as group leaders, again, your registered nurses can lead group therapy, and this can include activity, educational, task, and support groups. But those advanced practice registered nurses can also lead groups, but they can also facilitate more specialized group treatments such as psychotherapy. Leadership styles. There are three basic styles of group leadership. The first one is autocratic, and these people exert control over the group and they do not encourage much interaction from the members. The democratic leader supports extensive group interaction in the process of problem solving. And then the laissez-faire leader allows group members to behave in any way they choose, and they do not attempt to control the direction of the group. Now, group therapy. You need group leader supervision. The leader should provide feedback, help with transference and countertransference, support therapeutic group goals, and allow for debriefing, but they also need to be a role model. But there can be ethical issues in group therapy, and this can include things like informed consent, confidentiality, member removal if necessary, and appropriate training or credentialing. They should also be using evidence-based practice in group therapy to stay within ethical guidelines. But there can be challenging member behaviors. There can be that monopolizing member, and that's that one person that tries to control or take over the group. You need to remind them that group is for everyone and everyone has an equal opportunity to contribute. There are disruptive members. Teach them to listen objectively and speak to the member in private about their anger issues. And silent members. You need to determine the cause and allow this member time to feel safe in the group. Your expected outcomes. If you're in a medication group, you need to educate on awareness of side effects and interactions, as well as identification of time and dose for each drug taken. In therapy groups, the focus is on insight, behavior change, and a reduction in your patient's symptoms. So a registered nurse who leads a daily community meeting for patients in a psychiatric unit focuses on keeping a fixed, time-limited agenda. What type of leadership style does this demonstrate? D, autocratic.